I'm going to be going through the upper extremity muscle origin, insertion, and actions. We have 14 muscles to go through today, so starting off with the latissimus dorsi. The lats are going to originate on the spinous processes of T7 through L5, as well as the superior sacrum and the iliac crest, and then it's going to insert on the inferior angle of our scapula and the medial lip of the bicipital sulcus of the humerus. And then I have the actions are going to be shoulder extension, adduction, and internal rotation, and scapular downward rotation, retraction, and depression. Next, I have the supraspinatus. This is going to originate in the supraspinous fossa, and then it's going to insert into the superior greater tubercle of the humerus. It's going to help us with shoulder abduction and external rotation. Then I have the teres minor. Teres minor is going to originate on the axillary border of the scapula, and then it's going to insert on the posterior greater tubercle of the humerus. It's going to help us with shoulder extension, adduction, and external rotation. Next is the coracobrachialis. This is going to originate on the coracoid process of the scapula, and then it's going to insert on the medial central shaft of the humerus. This is going to help us with shoulder flexion and adduction. Next, I have the brachialis. This is going to originate on the anterior shaft of the humerus, and then it's going to insert onto the ulnar coronoid process and the ulnar tuberosity. It's going to help us with elbow flexion. Then I have the triceps, the lateral head. This is going to originate on the posterior shaft of the humerus superior to the radial sulcus, and then it's going to insert on the ulnar olecranon. This is going to help us with with elbow extension because it doesn't cross two joints. Next is the anconeus. This is going to originate on the lateral epicondyle of our humerus, and then it's going to insert on the lateral olecranon and the proximal posterior border of the ulna, and this is going to also help us with elbow extension. Next, we have the flexor digitorum profundus. This is going to originate on the anterior interosseous membrane, as well as the and then it's going to, on the anterior interosseous membrane, and wrap to the wrap the ulna to the posterior border. And then it's going to insert down on the distal phalanxes of digits 2 through 5. And this is going to help us flex our digits as well as our carpus, our wrist. Next, we have pronator teres. This is going to originate on the medial epicondyle on that common flexor origin of the humerus, as well as the ulnar coronoid process. And then this is going to insert down on the oblique line of the radius. This is going to help us with forearm pronation as well as elbow flexion because it crosses that joint. Next, I have extensor carpi radialis brevis. Extensor carpi radialis brevis is going to originate on our lateral epicondyle on that common extensor origin, and then it's going to insert down on the base of MC3. This is going to help us with wrist extension as well as abduction or radial deviation. Next, I have abductor pollicis brevis. This is going to originate on the flexor retinaculum, the scaphoid, and the trapezium, and then it's going to insert on the lateral base of the pollex proximal phalanx. This is going to help us with thumb abduction, flexion, and opposition. Next, I have opponens digiti minimi. This is going to originate on the flexor retinaculum and the hook of hamate, and then it's going to insert on the lateral diaphysis of MC5. This is going to help us oppose our pinky, or digit 5. Then I have palmaris brevis. This is going to originate on the ulnar side of the flexor retinaculum and the palmar aponeurosis, and then it's going to insert on the ulnar side of the hypothenar integumentary, and then it's going to help us tense the skin of our palm on the ulnar side. Last up is the dorsal interossei. This is going to originate on the adjacent metacarpal of 1 through 5, and then it's going to insert by forking to the abductor side of the proximal base of the proximal phalanx and the extensor expansion of digits 2 through 4, and then this is going to help us abduct our digits. And that's it. Thank you.